Yes.
Well, good afternoon, everybody, and thank you again for joining us. If this is your first health talk with us, welcome. If you're a repeat offender, welcome as well. Thank you. Our topic of discussion today is attention deficit hyperactivity disorder, and we're focusing on children and adolescents. We did a presentation about a week ago where we talked about adult ADHD. So today our topic is about the little ones. So, our overview, these are the things we're going to be talking about. One, we'll give you a little bit of an introduction. We'll define what ADHD actually is. We'll talk about the signs, the symptoms, how it's diagnosed, what is believed to be the causes of ADHD, the effects that it has on the individual, and what treatment options are available. We'll also just touch a little bit on the goals of the ADHD month and ways to support the ADHD month and the ADHD community. So, with that said, let us go ahead and get started. First off, according to the CDC, over 7 million children and adolescents in the United States have been diagnosed since 2022. Of course, that number has risen. And at that point, statistically, it was believed that about one in every nine children between the ages of 3 and 17 had ADHD. ADHD affects us all, not just the people that have it. It affects the children, it affects the family members, it affects our teachers in school. It touches all of us. And so we all know someone that it affects, and it's important that we learn about the disease itself. So, what is attention deficit hyperactivity disorder? Well, first of all, most people refer to it as ADHD, and is one of the most common mental disorders that affect children. Some of the symptoms include inattention, not being able to focus on one thing for any length of time. Hyperactivity, of course, we all know what that is. That is that movement that's not fit for a setting. They're fidgety, they're moving around, they're staring off into space, they're talking. And then there's the impulsivity. That's the acting that occurs spontaneously, like jumping from your second story bedroom window to a trampoline below. And that's a real life example. My son did that when he was 7. ADHD tends to be something that people assume to be negative or a disability. And it can be difficult at times, but ADHD can be managed as well. So before we get to talking about how it's managed, let's look at some of the early signs and symptoms. One, generally, ADHD will show up in children during childhood, sometimes as early as age 2 or 3, but not usually. It's not unusual for kids to be very energetic and impulsive when they're young. Sometimes they even have trouble focusing. But for kids with ADHD, these behaviors are persistent and can be disturbing both to the kids and the people around them. They become disruptive, like I said, inattentive, which means they do things that are not appropriate for the setting that they're in. The most common symptoms of childhood ADHD are the hyperactivity, the impulsivity. And impulsivity basically is I think it, I do it, and I think about the results later, if I think about the results at all. And inattention. It's very difficult for them to focus and multitask. These symptoms can show up in different ways for different people. Not all kids with ADHD have the hyperactivity. It used to be thought that ADHD and ADD were two separate diseases, but ADD, attention deficit disorder, is a subset of ADHD. So it may look different in one setting to another. For instance, the child may behave one way at home versus the way they behave in school, which may be different than the way they behave on the playground or interacting with other children. So kids with ADHD generally will have problems paying attention to details or following directions or staying focused on a particular task. They can be easily distracted by their own thoughts or things that are happening around them. It's very easy to distract them when there's loud noises, bright colors, a lot of activity, loud signs, loud sounds behind them. It distracts them from what they were initially focusing on. They seem fidgety or restless, and they struggle to engage in quiet activities. Growing up, my son had attention deficit hyperactivity, boundary discrepancies, borderline Tourette's. And one of the issues that we had was, to him, there was no such thing as quiet time. He couldn't sit still and read a book. So these kids act impulsively. When I gave you the example about jumping from a 2-story window to a trampoline below, my son did that at age 7, climbed out his bedroom window and decided he would see if he could reach the trampoline below. Well, he did, kinda. It ended up ripping his shirt. It launched him into an oak tree in the backyard, which ripped his shirt off, scarred his back, and then on his way down, he decided to hit the rail bar and dislocate his collarbone. Yep, that's ADHD. These symptoms can affect a child's relationship with their families, with other children, teachers, adults in general. They can also affect their performance in school and their overall well being. And a lot of times these kids are labeled as being disobedient, and it's not understood what's really going on with the child. So, navigating with teenagers is a little different. You know, as children with ADHD get older, their symptoms can change. You know, there are different pressures in school when you get to middle school and high school than what you had in elementary school. There's changes in their relationships with their peers. There's increased responsibility and the hormonal changes that we all go through. These can all influence a child or an adolescent that has ADHD in new ways. And it's difficult for them and it's difficult for the people around them. Some of the challenges with paying attention and impulsivity can affect their way that they function. They have poor time management and organizational skills. Sometimes they have difficulty prioritizing tasks and completing assignments on time. They have trouble managing their emotions and dealing with their feelings and frustration. They can even participate in risky or impulsive behaviors, such as substance abuse or unprotected sex. With these teenagers, like in childhood, ADHD can affect their social relationships, their self-esteem, and their performance in school. Teenagers with ADHD can also experience mental health issues such as anxiety and depression. So, how do we know if an individual has ADHD? When it comes to diagnosing an adolescent or a child with ADHD, the child must be, the symptoms begin in childhood, and generally that's before the age of 12. The symptoms have to continue into the teenage or adult years in order for them to be diagnosed. The criteria for the diagnosis differs slightly based on the age of the individual. Children up to 16 have to show at least 6 symptoms of inattention, hyperactivity, and impulsivity, or both, or any combination of those three actually. And in adults and youth over the age of 16, they've got to show at least 5 symptoms of inactivity, hyperactivity, or impulsivity, and include inattention. So kids seem to be more outwardly expressive of their ADHD than what you see in the teenagers. So to be diagnosed, a person's symptoms must also include the fact that these are occurring for at least 6 months. It needs to be present in 2 or more settings, meaning if a individual is hyperactive, inattentive, or unable to focus at school, but they're able to do it in other environments, they're generally not diagnosed as having ADHD. So the impairment has to be 2 environments or more. Stress, sleeping disorders, anxiety, depression, and other physical conditions can cause similar symptoms as ADHD. So it's always going to be important that you seek the assistance of a healthcare provider so they can do a thorough evaluation to determine the cause of the symptoms, an appropriate diagnosis, and then identify the effective treatments for whatever that condition actually is. So, primary care physicians sometimes diagnose and treat ADHD, or they may refer that patient to a mental health professional. During this evaluation, what the provider does is 1, examine the person's mental health and medical history, including mood, past or current health conditions. They look at the person's current, or if an adult, childhood behaviors, their school performance and experiences. And they do this to obtain the information about the patient's activity levels. And sometimes they may even get permission to talk to other family members, teachers, partners who know the person well and have seen them in different settings, because it's going to be important to evaluate how they're behaving in more than one setting. They use standardized behavior rating scales or an ADHD symptom checklist to determine whether a person meets the criteria for a diagnosis of ADHD. Administrators of psychological tests look for the cognitive skills, such as their working memory, their level of function, the ability to plan and make decisions, visual and spatial abilities or reasoning. And these tests can help a psychologist or a cognitive uh, physician to find ways to strengthen the individual's deficits and help them identify or rule out possible learning disabilities. Because not all of the symptoms of ADHD are actually diagnosable as ADHD. Anyone can have ADHD, but what we have seen is that boys and men tend to display more of the hyperactivity and impulsivity portion of ADHD, while girls and women are more likely to be diagnosed as inattentive ADHD. It can also be diagnosed at any age, although symptoms must begin in childhood, and they refer to that as before the age of 12. Adults with ADHD often have a history of having problems in school, work, and in relationships. And these symptoms can change as a person gets older, as they mature. And so the evidence of ADHD in an individual can change over the patient's lifespan. So when we look at children, they show the hyperactivity and impulsivity as the most common symptoms. Academic and social demands, increases in their responsibilities, can also increase their inattention. They become more prominent, and it interferes with their academic performance and their relationship with their peers. It's funny to watch. It's interesting to see that children with ADHD tend to get along best with other children that have ADHD. I had to learn that the hard way when I took my 9-year-old son to a movie for his birthday and allowed him to bring 7 of his friends with him. And at that time, I didn't realize all 8 of the kids, my son included, had ADHD. Can you imagine trying to go to a Star Wars movie with 8 9-year-old boys, all of them with ADHD? I know y'all are probably laughing behind this, but yes, it was an experience to say the least. In adults or adolescents, they show less hyperactivity, but it appears to be more restlessness and fidgeting. The inattention and impulsivity typically continue and cause academic issues, organizational issues, and relationship challenges. It's difficult enough to be a teen and you're going through all of these hormonal changes, these relationship changes, these identity changes. And teens with ADHD are more likely to engage in impulsive, risky behaviors, like we said, such as substance abuse and use, unsafe sexual practices and activities, even things like vandalism, easily persuaded into doing things because it's also a level of impulsivity. I think about it, I do it, therefore, it's immediate gratification. In adults, include our older adults, our seniors, they can show inattention, restlessness, and impulsivity as well. But those symptoms tend to become less prominent as they get older. They're less severe and less impairing. People learn to adapt to their environment. And as we get older, we do better in making the relationships with individuals that are more like us. They also have a low tolerance for frustration and stress, and sometimes experience intense mood changes. So, when we think about what causes this, well, there actually isn't a true definition of cause for ADHD. It is unknown, but it's likely to be a combination of genetics and the environmental factors the individual experiences. As far as genetics are concerned, ADHD is highly hereditable, and many people with ADHD have other relatives with the same condition. Environmental factors can trigger the ADHD due to things like brain injuries, exposure to toxins, difficulty during birth and pregnancy, smoking, alcohol, or drug abuse, and difficulty in delivering and lead exposure. All of these environmental factors can have an effect that can possibly lead to ADHD. So, the effects of ADHD. Many of you may know this or see this in your child. It can make it difficult for the kids to interact socially. And children with ADHD can get frustrated very easily and they're very impulsive. It can make it difficult for them to perform well in school or at work and can lead to poor time management and poor organizational skills. And as far as employment is concerned, Employees with children with ADHD have a difficult time keeping jobs as well because it's hard to meet the expectations of the employer when the employer expects, you to be there, and yet you have the responsibility and the obligation to take care of your child when they are in crisis. And so employment for the parents can be a challenge. Relationships. It can lead to unstable relationships. Um, Sometimes spouses don't quite understand. Teenage boyfriends and girlfriends can be very easily frustrated with the inattentiveness, the impulsive behaviors, the frustration that the individual with ADHD may experience, and those relationships don't last long. It can also lead to poor mental and physical health and can be linked to depression, anxiety, self inflicted harm, and suicidal ideations. It can lead to substance abuse, and ADHD has been linked in some instances to alcohol or other substance misuse. And it can lead to accidents. And what I mean by accidents, we're referring to accidents because the individual is not focused. They may have falls. They may risk have risky behaviors. Um, it's difficult with young drivers with ADHD because they have difficulty focusing on the challenges of the road and traffic and people and the lights. And so they're prone to have more accidents than adolescents who don't have ADHD. They may have sleeping disorders. ADHD can increase the risk of snoring, sleep apnea, and restless leg syndrome. It can also disrupt the body's circadian rhythm, which will make it difficult for them to fall asleep and stay asleep at regular, and wake up at regular times. So these poor kids tend to have all of these emotional issues, the frustration, the anger. Then they're disorganized. They don't seem to wake up on time. They have difficulty with relationships. They have difficulty managing multiple tasks. And it just becomes a big ball of anxiety and frustration for them and for the people that are around them and that love them and that they love. So, how is ADHD treated? Well, treatment can include a combination of elements, and in most cases, should be a combination of elements. That would include medication, therapy, and lifestyle changes. The medications that are most commonly used for individuals with ADHD are stimulants, and they work by increasing the brain chemicals that help with attention and thinking. There are both short acting and long acting stimulants available. One of the things that I found as a personal experience is most kids with ADHD react very differently to Benadryl than kids who don't have ADHD. Again, my son at the age of 9, 9 was a tough time for him. We gave him Benadryl because he'd had an allergic reaction to a bee sting. He received epi, and then we were told to give him Benadryl for the next 24 hours. We gave him one dose of children's Benadryl, and he was awake for 48 hours, jumping and running and screaming. And I thought I was going to have a heart attack. But we then were told, once we contacted the doctor and told them what was going on, they said, well, for some kids, it acts just the opposite of it does with other kids. And I thought, thanks for letting me know now. Anyway, the therapy. Psychological interventions such as cognitive behavioral therapy, CBT as it's known, can help adults with ADHD For kids, behavior therapy and parent training can also be very important. It's not just the therapies that the kids go to. The parents have to be equipped to deal with the ADHD child or adolescent as well. So, lifestyle changes. One, exercise can help. You can try to incorporate it into the daily routine. Spending time in nature can also help. Having stimulants that help to suppress the hyperactivity. In one of our previous discussions, Heather mentioned the fact that she has sounds that she listens to during the day to help her to remain focused and help to keep her calm. There's white noise that can be played for some children that will help them to sleep. Um, Spending time in nature is very important. Getting outside, getting the children outside, allowing them to burn off some of that energy as well. School-based programs. Many kids or children and teens with ADHD benefit from school-based behavioral interventions and academic accommodations. Academic accommodations can be very important for the child with ADHD. It allows them the time, the opportunity, and alternative means of maintaining focus and concentration. And there's cognitive training. These programs help to improve specific functions such as attention or memory or direction. And they are highly, highly recommended for children and adults with ADHD. Neurofeedback is another treatment. This is a non-invasive technique which uses electrical devices to monitor the brain activity and then provide feedback to help self-regulate. There's complementary health approaches. Some people will try these health approaches to manage ADHD symptoms, but it's always best to try and combine the treatments, meaning some people may try several options before finding one that works. A specialist, such as a psychiatrist or a pediatrician, can usually arrange for these treatments to take place. Now, I know I mentioned neurofeedback, and a lot of people don't know what that is. So I just included a slide just to kind of give you a little bit of information on how neurofeedback works. There are leads that are placed on the surface of the head that take an EEG, which is an electroencephalogram. That is the electrical activity of the brain, and it records this brainwave activity. A software program analyzes the EEG in real time, and then the software provides audio-visual feedback to the brain, reinforcing positive brain activity. And this stimulation over time causes the individual to create new habits and helps them to focus in on the impulsivity. The thing is it's not really designed for young children simply because they can't hold still long enough to keep the leads on. And so the leads are required to obtain the analysis. They can't keep the leads on, you don't get accurate information, therefore you don't get accurate feedback. I know there's probably questions about that, and I'll do my best to answer those, but my knowledge is probably superficial in compared to that of a specialist. So when it comes to ADHD awareness, ADHD Awareness Month is in October. And the goal of the ADHD Awareness Month is to raise awareness to ADHD. It's also to address reducing the stigma of ADHD. It's highlighting resources and support for people with ADHD, promoting early diagnosis and proper management, and creating a more inclusive and compassionate world. that includes individuals with ADHD. Inclusion is extremely important as well. And so, what are some of the frequently asked questions about ADHD? And so I'll try and address what's been sent to me so far. One of the questions was, my son stands frozen in one spot for long periods of time. Is this ADHD? Well, unfortunately, the answer to that is possibly, but it needs to be followed up by a trained professional. There is such a thing known as ADHD paralysis or ADHD freeze or shutdown. This occurs when people with ADHD or attention deficit hyperactivity disorder become overwhelmed by their environment or the information they're receiving and they shut down. And so there is a paralysis or freeze momentarily. But again, this is something that needs to be reviewed and discussed with a professional. Another question came in. My son has become almost nonverbal and shrugs to questions, but rarely speaks and is uninterested in regular activities outside of school. Is this ADHD? Again, possibly, but it needs to be followed by a trained professional. Attention deficit hyperactivity disorder can make it difficult for people to communicate verbally and non-verbally. People with ADHD can experience that shutdown that I just referred to when they are overwhelmed with emotion and then they have difficulty speaking. Those were the two initial questions that were asked. At this time, I will take any other questions that you might have so that we can address them. Heather, I'm going to turn this over to you to let me know what questions you may have in the chat box, or if you have questions, you can unmute yourself and ask.
If you have any questions, please post them in the chat, or you can take yourself off of mute. Doesn't look like there's any questions.
Wow. That's great, guys. Well, I hope this information has been helpful.
I'm
Um,
sorry.
Go
I
ahead.
have a question. I was typing it in.
That's
So
okay,
do
Alma. Go ahead.
okay, so do you have a resource list that would be available for parents for children with ADHD? You talked about parent training, those cognitive interventions. Is there a go-to place that we can refer parents to? Because that seems to be I work at a school district, and so that seems to be a common issue. Parents hear about these cognitive therapies, but they don't necessarily know where to go.
So I will, because my son has ADHD, so I've had to do all kinds of therapy for him, such as PCIT, parent-child intervention therapy, and the cognitive, because the goal is for the kids to not always to remain on medication. It's to help get them on medication temporarily while they're working through their behavioral issues. So let me see what I can pull for you, and I'll send that out to everyone that pre-registered so that you guys have it. Because there are organizations out there that have the training. There's also some that do it online. And then there's some places here in San Antonio that do that PCIT training with the parents, and they're actually getting involved where the parents and the child are working together to help set those boundaries and set those parameters of what the expectation is when being asked to do certain specific things. So I will get stuff out if that helps.
Yes. And also just if I just wanted to have a request, if there could be, if possible, information for those families that may not have really insurance
funding,
or have the ability to pay for these, because I know that there's a lot of organizations and advocates, but they do come at a charge, and it's quite a hefty charge at that. So just thinking about the population that we serve here, I feel that would be helpful.
There are several organizations, though, here in San Antonio. I shouldn't say several. There are a few organizations here in San Antonio that are nonprofit and they do preliminary screening, and they do provide uh, environmental uh, change therapy, that kind of stuff. And I can work with Heather, and we can make sure that we can get you a list of those that do and don't require insurance or outside funding.
Thank you. That would be wonderful.
There are chapters of the ADHD chapters in San Antonio also provide resources or a resource list, and you can get that information online. I was trying to see right now if I could pull up their website, but um, it's not letting me with the presentation. Heather, am I still sharing?
No, I think you took it off.
Okay, good. I wanted to make sure because I want to find this first, and then I'll be able to share if possible. Guys, I apologize. I have a brand new laptop, and things are not where they used to be on my old laptop, so finding stuff is a little more difficult for me. I apologize. If I don't find it here in the next few minutes, we'll add it into the information that Heather's going to be providing to you with the recording. Were there any other questions?
I'm
Is there?
sorry. I have one more question.
Sure.
Is there any data, or could you point us to the right direction that would show the I guess the advantages or disadvantages, or what does data say in regards to placing children on psychotropic medication to address the ADHD? I mean, do we find that it's helpful or not as helpful, or what do we have any data that speaks to that?
Yes, there is data that speaks to that, and it is provided through the CDC. You would have to go to the CDC website, select ADHD, and then you can look by region what's happening with people in that area. The CDC provides that, and I do believe too that the health department here in San Antonio provide some statistics, but the statistics that is provided here is based only on what's reported, and it's based on the numbers of individuals who are on or prescribed medication versus the number of individuals diagnosed that are not. But I don't think it provides any information regarding preference. Does that make sense, Alma?
Yes, yes. I guess I guess when I speak to parents, my thought is more are one thing that I hear from parents that are hesitant to put their children on medicine is their concern for, well, the long-term effects, right? Or side effects of the medication. And do when you compare it to cognitive therapy to address the behavior, um, which is better, or do we really see an advantage to being on medicine or not? So those are the kinds of questions that I get in my role here,
Right.
where I
St-
work. Yes.
Statistically, it's been shown that children that are put on medication and have cognitive therapies tend to do better. The medications are designed to increase focus while the individual is learning behavioral modifications. Um, for a lot of children, they don't necessarily outgrow ADHD, but they develop coping skills that allow them to come off of the medications. So,
Got it. That makes
yeah,
sense.
yeah. Like my son, the same kid that I told you about that's jumping out of windows and doing crazy stuff is now a 33-year-old father, and he still has ADHD, but the signs and symptoms are very, very minute. And yet there are other adults whose symptoms are still rip roaring, and they need medications to be able to function in today's society, especially if they are in high performance, high competitive jobs. I have a friend that is actually a surgeon who has ADHD, who is still on medication because he says he needs that ability to focus to do his best at his job.
And I will say one of the things that I've noticed too, and some with because my youngest is off the chart ADHD and obstinance defiance disorder too. But he's what I found with him, they get overstimulated
Mm-hmm.
in crowded environments when they have too much TV. You wouldn't think, and many people wouldn't think, the television would be a stimulation for them, but it is. Electronics are just a huge stimulator. So, but you're looking at them going, okay, but they're calm when they're watching it, when they're calm when they're at the TV, they're calm when they're on the computer. It's and then they're bouncing off the walls later. It's because they've had that overstimulation from that electronic. So like my doctor, when we were trying to do organic without medication, it was green tea in the morning, um, meditation music throughout the day, and then chamomile tea at night. And it helped to a point. And then like 30 minutes of TV at at max. What I found with him is even 30 minutes of TV was too much. So he literally gets 10 minutes of TV a day. That's hard when you're trying to watch a movie. But he literally gets 10 minutes of TV a day because any more than that, and he has trouble the next day. But that's also, you go to SeaWorld, you go to Six Flags, you go to the museum, all these other places, and monitoring when it gets really crowded, what happens with their behavior the next day. Because I know with my son, that's what happens. He could be fine today, but the behavior the next day is a precursor because of what happened the day before.
Very interesting.
Um, so I know also another factor that comes up in trying to deal with the ADHD. I know that diet can also affect. We hear about red dye in foods. Of course, we
Right.
know the sugar. I mean, I think that's even with children that are not ADHD or adults. So um, I, I thank you for sharing that in regards to, the green tea and limiting the school, their screen time.
I found the resources that I wanted to show you. I'm just having difficulty now sharing my screen. Getting back to the Zoom. How do I get back to my Zoom? Let's see. I apologize, guys. I'm trying desperately here to get back to the Zoom, and it's not letting me share my screen. Oh boy. I'm going to sign off for a second and sign back in so that I can share this with you guys. Oh, here we go. Can you guys see that? Resources for children with ADHD?
Yes.
Okay. There are books, there's organizations, and these are national. These are not restricted to San Antonio. So what I'll do is I will have Heather, you know what, rather than having Heather do anything with it, I'll add this information as a resource or resources on the slide presentation. That way, when you get the presentation, you'll have this as part of it. Okay?
Thank you.
You're welcome. Any other questions? No, we're a little early. Well, if there are no more questions, I thank you all again for your attention and your time. We hope that this information has been helpful, and we hope that you will join us again for another of our Lunch and Learn talks. As Heather mentioned, I believe we have one on the 27th, and at that point in time, oh, actually, we have one before that.
Yes, the nutrition health talks that we have,
Yes,
the weekly series.
right. We're doing those, and please join us for those. There, not only are we talking about dietary limits and restrictions for certain diseases, each one of those classes at the end, I do a demo of some sort of a healthy snack. And, you know, if nothing else, you'll learn some things that are good for you, good for your kids, and good for whatever disorders you may have. So please do join us. With that said, thank you. And I hope you guys have a great rest of your week, your weekend, and happy Valentine's Day.
Thank you for joining us. We greatly appreciate it.